We're here at the Cancer Control Convention. Can you talk about the connection between vitamin D and cancer?
Absolutely. I'm just here to report the highly beneficial effects of having an optimal level of vitamin D in your blood at all times if you want to prevent cancer, and certainly once you have cancer. Mm-hmm. And those levels, again, you want close to 100, maybe not much over. You want to get checked regularly, but somewhere between 80 and 120 is a dose that we know from research that helps control cancer cells. And vitamin D controls cancer cells by apoptosis. Apoptosis is self-cell destruction, cell suicide. So when a cell becomes genetically unhealthy and differentiates and turns into a mutant cell, cancerous cell, then those cells, if you have optimal doses of vitamin D, activated calcitriol in your bloodstream, will commit suicide, or your body will help get rid of that cell, that unhealthy cell. Mm-hmm. So very important that vitamin D optimal levels will help control that. Other things it does, another important aspect of vitamin D is that it causes anti-angiogenesis. Angiogenesis is a type of, is when a tumor becomes big enough in your body, it starts developing little blood vessels. It starts growing blood vessels, and the blood vessels go into your tissues to get the blood supply, and that's how they live, and that's how they grow. Well, vitamin D, in all its glory, helps stop the process. It actually helps stop the blood vessel formation from the tumors. It's considered a very strong, potent anti-angiogenic factor. So that is one of its most glorious things it does. It's also been shown to halt tumor growth if your levels are optimal. That is, that's the operative word. You have to have optimal levels, and very few people do. Even after years of reporting on it and talking about it, people don't quite understand that you have to have an optimal level of it. So the tumor growth really got me. I was I see it in my practice. People start increasing their level of vitamin D, and they go back to their oncologist. I always work with oncologists, and we get CTs done, blood work done, and their tumors stop growing. So this is why I'm very in love with vitamin D, and I'm still on the bandwagon. I'm researching it, and always use it in my practice.
And that type that you're talking about that can treat cancer, is that a kind that you can only get through a doctor, or is that just still an oral supplementation, or what?
So when you take oral D3, if you take it in correct amounts, at certain times, with certain meals, by the way, and it's also a little bit picky because it doesn't want to be around magnesium, vitamin A, even though those are synergistic cofactors, you just can't take them at the same time. You also have to have enough fat in your diet, etc. So when you take enough vitamin D, it goes through your liver and turns into 25-hydroxy vitamin D, and then it travels into the kidneys. If you have good kidney function, it turns into 125. It's called, sorry, I made a mistake there. It's called 125 dehydroxy vitamin D. So 125, even though it's the activated version, still has to go into the receptor site to become this all-powerful steroid hormone called calcitriol. And so it does have to go through a few pathways in your body to become that hormone, but the oral supplementation is the first step. And again, you have to take it with food, you have to take it usually with some sort of oily substance, and as long as there's nothing else that, if you have any biliary problems, if you don't have any problem with digesting fats, it should get through. It then travels to the liver and then into the kidneys. And it will stop in the kidneys and help the kidneys out. if your kidneys are prioritizing it because you don't have enough. But once you have had infiltrated, and once you kind of filled up your reservoir, then and your tissues saturated all your fat cells, then your body can use it for the immune factors.